Welcome back to the Rick Smith Show. Now, here is Rick Smith.
So Congress can't seem to get their act together. Thank goodness the Supreme Court, while working to destroy our democracy, didn't completely destroy our healthcare system. There's something positive, I guess. But since we can't get things done right in Congress, there's some really unique and innovative things that I love that are going on around the healthcare industry. Because as we know, and we've talked about for years, medical debt is the leading cause of bankruptcy for working class Americans. That is the reality. Someone gets sick, unlucky, kid falls, break both legs in the courtyard. Now you're broke. And this is why I think we have to have a reasonable healthcare system. But also, how do we help people when these moments come up and you end up in deep, deep debt? The good folks over at RIP Medical Debt have come up with an interesting idea. I'm sure you saw this on John Oliver's special, but here to share some thoughts on what RIP Medical Debt is and what it does. And, well, maybe we could do more of it. I've asked Allison Sesso to come talk with us. She's their executive director. You can make sure you check out their website, ripmedicaldebt.org. But Allison, thanks for taking time for us.
Thanks for having me. I love talking about medical debt.
Yeah, I mean, this is one of those things you just get really excited about, really pumped up. We're going to talk about debt. But I got to tell you, I love the fact that there's someone out there helping people who are burdened by this, because I know people who have, their lives have just been torn apart. The kid got sick. They maxed out their insurance, and now they're saddled with debt for decades and nowhere to go. And I just think that's flat out wrong.
Yeah, I mean, I absolutely wholeheartedly agree. I mean, this is American exceptionalism in a way that we're not proud of, right? I mean, this is a uniquely American problem. The way we finance our healthcare access and system is fully broken. It is headed in the wrong direction. And frankly, I'm proud of the work that I do every day, but I absolutely wish and don't believe I should exist as an institution. So I'm happy to be abolishing people's debt and being out there getting we've gotten rid of $4.5 billion worth of people's individual medical debt to date. Wow. And I am on a roll. We're going to get a hell of a lot more. However, I don't think that this problem is going to be solved by me. And I think what you said earlier about Congress not really acting on this is wholeheartedly true. I think if any of us were acting like Congress, we'd all lose our jobs and be fired. They're just not getting their act together, and people are frustrated.
No, and as we should be. And this is one of those things where I go, why can't we get our votes together and throw some of these bums out and actually get something done? Now, I understand your organization, RIP Medical Debt, was founded by two debt collectors, which, again, don't take this the wrong way, but I put debt collectors in the category of some of the worst human beings on earth. But that's just my personal opinion. In this case, I got to be nice to them because I think they've taken their evil knowledge and I think they're using it in a good direction.
Yeah, if you believe in heaven, they got their ticket in by turning their things around for themselves. I can tell you that. Jerry and Craig, they're the founders of RIP. They took a big risk financially to start this institution. But I think that they were just driven by the fact that they understood how broken the healthcare financing system is and how kind of ridiculous it is how low of a price you can pay for someone's medical debt. And they thought, well, if people want to give donations, we can actually get rid of quite a bit of medical debt. I mean, $1 on average gets rid of $100 worth of medical debt. So that's why we've been able to get rid of $4.5 billion. It's not that we've raised $4.5 billion in funding. It's that the amount we're paying is relatively low. And so they sort of, if you will, took their knowledge and put it to use for good.
Yeah, a little redemption. I'm. That's a good thing. Maybe there's going to be a place in heaven for them because, after all, debt collectors way down on my list. But here's the thing. I mean, you're talking about writing off $4.5 billion in debt. It just seems like to me there's got to be a better way because somebody's paying for that. The rest of us are paying for the healthcare costs. There's got to be a better system than ruining people's lives when you're only going to write it off anyway.
Correct. 100%. I mean, first of all, the pricing of medical expenses are based on no logic at all. There's no rationality to how hospitals price things, and oftentimes, it's all over the place. Our insurance system is, when people walk in the door, they're not well insured. I'll tell you, a lot of the debts that we take care of are people who have insurance. This isn't a uninsured necessarily problem. Yes, there are certainly people who don't have insurance, but the fact that the insurance is so complex, people don't understand what their insurance covers. They're underinsured by a long shot. They might go out of network, and you got to read the fine print. I mean, we're all busy people. We don't have time to be looking through documents and figuring out, if I need health care, I've got kids to take care of. I'm working every day.
Yep.
People are overwhelmed, and they're supposed to read the fine print. Give me a break. I mean, that is part of the problem, is that it's so complex that people are walking in the door of the hospital not knowing what their actually responsibility is. And increasingly, the responsibility is right in the lap of the individual. And it's, between the insurance company and the hospital, they've got a racket going on, the two of them, in a way that's really falling at the feet of poor Americans.
Now, I've been very fortunate, and I talk about this all the time here on the show. I've got the best union health care you're going to find anywhere. Like I say, I had a hip replaced about a year and a half ago. Cost me $120 out of pocket. I've got insurance that Congress is jealous of, but that
might be true. But I'll tell you this: I bet you that the institutions could pay more in salaries if they didn't have to pay the insurance company so much to make sure that your insurance is so good. So everyone is still losing.
No, and this is where I'm going. I mean, I want people to have the same kind of peace of mind, same kind of coverage that I had. But even in our insurance, as good as it is, you go into that hospital, you got to worry about, is the anesthesiologist, who I don't even know, is he
out
covered our insurance? And this is how a lot of people get tripped up. They're playing along what they think the plan is doing. They're trying to stay in network, and then all of a sudden, oh, well, I didn't know that guy or that guy wasn't, and they get socked with massive bills.
Well, and I'll tell you, I increasingly liken it to like the subprime mortgage crisis, because I think that it is kind of a racket in that way, that it's absolutely taking advantage of people. When somebody has a level of insurance in which their deductible is so high that they know that they couldn't meet it, then they shouldn't be able to have that plan. We need to make sure that people have insurance plans that meet their income levels. If you are living paycheck to paycheck, and you have an insurance plan that requires you to pay a $4,000 deductible, good luck collecting on that $4,000. So then what happens? You own a home, and then the hospital can sue you for that $4,000 and put a lien on your home. It makes no sense at all.
So walk me through how you got into this, because I'm thinking about this. I'm going, wow, this sounds like a way to go about it. I'll just get my medical debt and I just buy it from the debt collector, and then I can wipe it out, and it won't ruin my credit too badly. But I guess I can't do it myself, can I?
No, it's a little more complicated than that. It's simple yet complicated. So debt in the United States can be sold, but it's up to the person who owns it. So to be honest, frankly, not a whole lot of hospitals sell their debt. I mean, a fair amount do, but I think it's something like 30% of them actually sell the debt. Now, a lot of them keep it have collections agencies work the debt. That's different than letting go of the title and selling it. So I can only buy it either directly from the hospital or from the debt buyer. And that's traditionally how we did our work. We bought it from the debt buyer, and increasingly we're buying it from the hospitals directly, because of the fact that if I'm only doing it from debt buyers, then I'm only getting access to roughly 70% of the debt that's out there. And so that's how we do our work. Nobody can come to us and say, hey, I've got debt, can you buy it? We buy large portfolios, like the whole thing that a hospital has, that they've basically written off their books. They consider it bad debt. They have no intention of collecting on it. Maybe they have it somewhat of collection efforts on it, but mostly it's just sitting there on their books. And it may not even be collecting on it at all. And we say, give us that debt. We'll pay you for it. We'll pay you what a debt buyer would have paid for it. And it's, again, pennies on the dollar. And then we send letters to individuals and say, this hospital worked with us. They understood the value of what we were bringing to the table. And this debt is forever gone off of your plate. You do not have to worry about it. And we send people letters. So it's like, winning the lottery without applying. You actually can't apply. It's source driven. So it's once we have the debt, we can get rid of it. And how we do that and how we're able to pay for that is with donor dollars. I mean, you talked about it earlier. A lot of Americans are frustrated. Their Congress isn't doing something. Well, through RIP, people can do something pretty big and pretty tangible. Like I said before, $1 gets rid of $100 of debt. So you give us $100, we get rid of, $1,000 debt. It's a big deal.
That is a big deal. And, but here's the thing that gets me now. And I guess the question I have, once you do this, once you send out the letter, once you've paid the debt, the hospital has written it off, it's down the line. Does this harm the person's credit rating still? I mean, is this still you, or, this is you got the black mark on you forever?
No, that's part of it. We make sure that we make sure that any black marks that were on the credit are gone. That actually the hospital has to do that contractually. Once they transfer the title over to us. So that is taken care of. And there's also, by the way, it's important, there's no tax burden. If the hospital were to forgive this debt directly themselves, the individual would actually have to claim a tax, like they'd have to pay taxes on this gift, basically the forgiveness of the debt. And through RIP, that doesn't exist. So it's actually a really brilliant model, because it really doesn't have any implications except for the debt being wiped out for the individual.
No, and I this is one of those things where we're in this weird time, because even the hospitals are struggling to get some revenue, because we've so squeezed the model down to where the insurance companies are profiting, these medical groups are profiting, that the community hospitals are just being wiped out.
And we're not getting any good outcomes, by the way. The health outcomes are crap. I mean, that's the other part of this, is we're not, we're the overall, everyone's making a buck, but the individuals aren't getting the actual good care that they need.
But Allison, no. We've got the best healthcare in the world. Haven't you heard? And people love their employer-sponsored healthcare.
Yeah. I mean, look, if it's working for you, I guess. I mean, you're going to have some bill collectors knocking on the door if, God forbid, something happens to you. If you want to leave that to chance, then good luck.
No, I mean, the thing is and I say this all the time, I'm fortunate, I have good health care, but I pay through the nose for it through deferred compensation. Our contract negotiates a huge amount of money to pay for this that our members get this. And I'm of the mindset that, if we're spending all this money, shouldn't we be moving towards a system that makes sure we get better outcomes, make sure we have more preventative care, make sure we do the smart things we can do, but that nobody has to worry about, hey, am I going to go broke? Am I going to lose my house? Am I going to be forever burdened with debt and a black mark on my credit because I got sick or I needed a hip replacement? I'm fortunate. I didn't think of any of those things, and I want that for everybody.
I agree. I think that healthcare should be a right for individuals. Absolutely.
So, we're in this moment now where we've all been locked down. We're all afraid that we're all going to get sick and die of COVID. And how has the virus, how has this last year and a half affected healthcare? Because a lot of people have lost their jobs. And when you go on unemployment, you may have got the extra couple $100 in federal aid, but you didn't get any health care. How has that affected the hospitals? How does it affect what you guys do?
Yeah, I mean, a huge percentage of people have lost their employer-sponsored health care, and that really creates massive problems for individuals. And maybe they go and try and buy a package on their own, but again, the likelihood that it's going to be a good coverage, because the deductibles are going to be high on what they have, the chances of them being exposed to medical debt is pretty high. So it's not a good situation. I would definitely encourage people to negotiate directly with hospitals if they are if they have a medical debt, or before they go walk in the door on the price. It sounds insane, but I think that that's what people have to do. So that's one thing that I definitely advise people, is to actually negotiate, to understand what your insurance is. But the pandemic has really, I think, not only has it taken insurance away from people, but it's a clash of our finance system, of our healthcare system being broken and getting worse. And then also, and the CARES Act didn't do enough to protect people as we thought it was going to, and it was allegedly discussed. What happened in that is that the hospitals could bill the federal government themselves, as opposed to the money following the individual to the hospital system. And so it really didn't protect people in the way we thought it would. And so a lot of people end up with COVID-specific healthcare debt. A lot of people aren't insured. And then just in general, even if your issue wasn't COVID related and it was just whatever it was, your economic situation has worsened as a result of COVID. And so many more Americans are struggling financially. Yes, we're doing a lot to help them, and we're seeing some signs of the economy rebounding, but it's still very imperfect, and a lot of people are struggling.
Yeah, we have an awful lot to do, and I can only imagine how much it's been magnified by the pandemic and people losing their jobs. And again, this is a failure of Congress, in my view, to act and to strengthen the ACA, which I wasn't a huge fan of. It was a step in the right direction. I was told eventually we'd be at a public option.
12 states haven't taken up any of the Medicaid expansion money, which is insane, and the medical debt in those states is higher.
So how do you deal with the difference in those states then? I mean, are those hospitals selling more, or do you see that difference then?
Yeah, I mean, we're definitely thinking about our strategy overall and whether or not we should be focusing more intently on those states. And I don't want to just forgive debt and clean up the mess. I want to be able to tell the story and show that difference so that it frankly gives the people who are advocating in that state more to fight for and to say, what are you doing? Georgia, for example, to call one out, like you need to take this federal money. It's hurting your people and it's costing the state money. You really need to make sure that you take this additional funds. And I agree with you. The ACA is imperfect. It was the best we could get at the time, and we need to build off of it. And I think, you were going down the road of single payer. Well, I'm not sure whether or not we need a single payer, but we definitely need a public option at the very least.
Actually, that's where I was going. We were told that this would eventually lead to a public option. I am a single payer person. You're correct. But we were told that eventually this could lead to a public option, which, I'm okay with. I'm okay with, opening up Medicare and affixing a price to it and allowing me to buy into it. That gets me to the place where I want to get. I know the Republicans and the conservatives love to argue that competition, but healthcare doesn't seem to have a lot of competition in my view, nor in my view should I have competition, because when I'm dying of a heart attack, I'm not speed dialing to see who's taking a coupon this week. So last question I've got for you. How do we help? What's the ask? What do we need?
Well, please donate. I mean, support RIP medical debt. The way this works is that we take donated dollars and we turn them into debt relief. And yes, I can't buy your individual debt, but I'm out there buying as much as possible. So the more people that talk about us, that contribute to us, the more debt relief I'm going to be able to get. I want to get to a point where I'm doing $10 billion a year. So I'd love for people to support us and to frankly also tell their stories about medical debt. Don't be ashamed of it. It's the system. It's not you. And you need to be not ashamed of the fact that you have medical debt. 43 million Americans do. It's very normal, unfortunately.
It's horrible. Allison, I appreciate the time. Hope people will visit the website, ripmedicaldebt.org. We'll get links out on social media how they can make donations. But I appreciate your time. Thanks so much.
Thank you so much, Rick.
Good stuff. Allison Sesso. Again, ripmedicaldebt.org. Quick break. Right back. Stick around. You're listening to The Rick Smith Show.
Remembering that united we bargain, divided we beg. Rick Smith.